Hi, my name is Rick Gonzalez, and I'm a respiratory therapist who specializes in treating people that have breathing and airway clearance problems due to neuromuscular diseases such as ALS. I've been asked to briefly discuss invasive and non-invasive ventilation and also airway clearance devices. So the main question, if you want to jump right into it with the breathing part, is a lot of people ask us, trach or no trach. It is still a personal choice, but I can tell you that clinically that you do not need a trach to breathe. I've actually had a patient that was over 50 years breathing non-invasively, never got a trach. It is necessary, however, if you are at risk of getting repeated aspiration pneumonias from your own secretions. In other words, you can't handle your own saliva and secretions. Everything keeps going down the wrong pipe and into the lungs. So that's being put very bluntly. The other question that typically follows is, what's the difference between invasive and non-invasive ventilation? Invasive literally means that you do get a trach tube put in. Non-invasive is using an external interface, very similar to what they use for sleep lab studies for CPAP and BiPAP. So they're external devices that you can use on the face. As far as the breathing machines that are used, a lot of clinics, they'll commonly order what's called a BiPAP machine. I'll do a little show and tell. This is an example, perhaps a little bit of an older model, but it is a BiPAP machine. This is the size of it. And then the interfaces, this is just a sample of one that would just fit over the nose. Okay. And they are commonly used. They do have limitations as far as their effectiveness. With all neuromuscular conditions, regardless of what issues you have, the lungs tend to get stiff. So it's very important to do what we call lung recruitment, which means to keep stretching the lungs out so we can use the full surface area of the lungs inside. Those machines can be limited over time as the pressures increase. They may not give as much air. There's also no portability. Unfortunately, you can't put one of those on a wheelchair. There's no battery backup and no alarms, if I hadn't mentioned that. Also limited controls for the clinician to make adjustments for comforts and settings. The other option, and the more effective one, is the non-invasive ventilator. This is an example of one right here. Okay, so that's a non-invasive vent. It can ventilate trach patients as well, but we use it in both ways. The advantages of the ventilators is that we basically can ventilate any breathing condition. Any problem you have, that machine does almost everything that the hospital machine can do. There are alarms. There's plenty of battery power that's available to it. That machine actually has an 8-hour battery built in, and you can add additional batteries to it. It obviously can be placed on a wheelchair very easily. Clinicians have a full array of controls for patient comfort and for effectiveness. The next thing that typically people like to see is, what is it that we're putting on our faces to make this work? So I just have a few samples here. And this is what's called a full face mask. And as you can see, it covers both the nose and the mouth. Okay. And this is just another sample of a similar type of device. Then we have smaller ones. And the reasons why there are so many available is because everybody's different, and what works for one patient may not work for someone else. This one is very small, and it just fits over the tip of the nose. It's actually too small for me, but for little people it does work. The nasal prongs are or nasal pillows are also called, are very common. So basically you would go over the head like this, and these prongs kind of go in the nose and back. So it's very easy to put on, actually, and you can still wear glasses and watch TV and read if you like with this particular device. It really doesn't get in the way very much. And then the other one that I showed very briefly is what's called a nasal mask. And the nasal mask literally fits just over the nose itself. So you do have quite a few options. We also have one more that is used a lot of times during the daytime. And that is, believe it or not, you can put a mouthpiece on it. And it would just go to the end of the tubing. And we could position this in pretty much anything from a wheelchair to a computer desktop, wherever would be convenient. And would basically be right there, and the patient can still talk and just take breaths like this without having anything on their face at all. And I have patients that have zero ability to breathe, and they'll have this during the day, and they'll just do that and keep it right next to them. Okay, so moving along, that's a really quick overview of ventilation. The other part is the airway clearance. What's currently called the cough assist machine, there are different machines on the market, and they do have different names. It's basically a modern version of what was the cougholator. The cougholator was used back in the polio days, and it's went away for a while, and it's come back in the last 25 years or so, and there's modern versions that are very effective. The machine itself, I call it the pneumonia preventer, because it is the machine that will clear the lungs out and keep you from basically getting a bad pneumonia and having to go into the hospital. One of the machines that I have here, this is what it looks like, okay? And it can be used either with a mask, like this, okay? Or some people prefer it with a mouthpiece. And the way it works is that a natural cough is a deep inhalation followed by an explosive exhalation. This machine is almost a backwards cough. What it does is it gives you a deep breath going in, followed by a vacuum cleaner suction. So it actually goes, and then it feels like it's pulling out. It sounds a lot worse than it is. Basically, most people say it actually feels quite comfortable, and the deep breath part going in is just as important as the vacuum cleaner part, okay? The lungs divide 27 times. You can only cough from the top 7 segments up. So that's why a lot of people feel like there's secretions that are always stuck in the throat, and it just can't clear it, the constant This machine will clear that. Once you use the mask is the most common one, and once you use the mask, pulls up, and it doesn't always bring the secretions up immediately, especially if you feel like there's a little bit of rattling in the chest. So it's not uncommon, about 10-20 minutes later, all of a sudden you find yourself trying to clear your throat or using the machine again. Once again, you can either do it that way or with the mouthpiece, and depending on how many secretions there are, some people can just use a napkin and just wipe a little bit into it. I have seen sometimes where people will just kind of use a cup and just expectorate a little bit into it. Also, it's very common that you can use a Yankauer tube, which is basically just like a dentist tube for mouth oral clearance, and this would be connected to a portable suction machine, and you would just go, and it would suck up and clean up the mouth and get everything that's in there. You wouldn't go deep, but just around the mouth, and that would be for the oral suction part of things. We typically recommend that you use the cough assist machine 3 times a day. The most important time is when you first wake up in the morning, because that's when you're most congested, just from laying down. If you can squeeze one in the middle of the day, it's just a good thing to do. A lot of people ask me, is there a type of physical therapy I can do for my lungs? There isn't a lot, but this is one of the things that kind of works from the inside, because it will stretch your lungs out, so it's very important. The last treatment, a lot of my patients tell me they'll sleep better if they clear themselves out prior to going to sleep. And especially if they are on a non-invasive ventilator of some kind, it just clears them out beforehand. That's basically the gist of it in a short time frame. If you have any additional questions, then you can reach out to your treatment centers, and I'm sure that we can get you more information as needed. Okay? So thank you for your time and your attention. I hope I was of some help, and be well.